Oh, it even announces it. All right. I'll just start again. Thank you, everybody, for, first of all, even agreeing to take part in the Mayoral Ad Hoc Committee on Reducing Poverty. I'm so excited to be with this group of people, and I think we're really going to make a difference in our community when it comes to poverty. We have 5 working groups that are incredibly hardworking people that have committed the last 2 years of their life preparing for this ad hoc committee. And we're fortunate as an ad hoc committee, they're going to do the heavy lifting, and we're going to be here to hopefully provide some oversight, but more importantly, provide guidance, advice, if they come ahead facing barriers, trying to help them get through those. But I can assure you, we're all going to be impressed with the work that they do. They're extremely committed, and a good chunk of them are school staff. So I want to thank Jake Langmus for really being supportive of the work that we're going to be doing by allowing staff for the last 2 years to work on this. So with that, I'd like to start with introductions. Now, usually the first couple of meetings are kind of clunky. We don't know each other yet. So don't let that bother anyone as we work through this. I was on a pretty long committee with Tanya, and I think it started like that, really slow, but boy, once that group got going, they produced some good work, and I expect the same will happen here with all of us. So with that said, my name is Mark Kerr. I'm the mayor of Lewiston. I've been an elected official in Lewiston for at least a decade, and I served with some incredible counselors, and at least one of them is here with us tonight, Representative Cloutier. So that's who I am, and with that, I'm going to turn it over to staff first for introduction. So I'll start with Marcella, and then Marcella, if you could pass it on to someone else.
Sure. My name is Marcella Paris. I'm the Lewiston Public Library Director with the City of Lewiston, and I'll be serving as a staff liaison for this committee. And I will pass it over to Dale.
Hi, I'm Dale Dowdy. I'm the Deputy City Administrator, and I've been in public service for about 30 years, most of it statewide, but for the last 2.5 right here in Lewiston.
You can go ahead and pass it off to Tanya.
Sure. Good evening, everyone. My name is Tanya Bailey Curry. I'm a licensed clinical social worker at Bates College, and I own a small private practice catered to BIPOC individuals and a lifelong native of Lewiston. I'll pass to, sorry, Mayor Kerr.
That's all right, go ahead.
I'll pass to Kristen Cloutier.
Thanks, Tanya. So I have the extreme fortune of knowing most everybody on this call pretty well. So I grew up in Lewiston, went away, came back, raising my family here, served on the city council for 3 terms, have been on the school committee. Basically, if you name a level of government, I've kind of served on it. I was on the county budget committee, the school committee, served as mayor for a very brief time, and now I'm serving in the State House. And I'm so happy to have been asked to be here and to be here with all of you. And I'll pass it to Megan Parks.
Hi. I apologize. I'm in my car. I'm at my son's baseball game. I kind of overbooked myself today. My name is Megan Parks. I am the chair of the Lewiston School Committee. I've been a Lewiston School Board member for 6 years now. Born and raised here. I have a private practice in downtown Lewiston. I'm a social worker and a substance use counselor. And I currently run the quarantine and wellness program, which was just taken over by Preble Street, but was with Community Concepts until recently. And I participate in a wide variety of committees and subcommittees in Lewiston as well. And I can only see 4 people on my screen, so I don't know who to pass it to. Bill Grant, I will pass.
All right, so Megan, I would be in the same position as you, but two baseball practices got canceled this evening, so I'm in the comforts of my home. But I'm Bill Grant. I am actually one of the folks that was on the original subcommittee for poverty, and I'm serving as the school liaison, but I'm also the adult ed director here in Lewiston, and I also do it over in Auburn as well. And I will pass it on to Karen.
Thanks, Bill. So Karen Paquette, I'm currently the assistant superintendent, but I've worked in Lewiston Public Schools for 14 years in a variety of roles. And I'm new to this committee, but I have been following the work, and I'm really excited to be part of it. And so I thank the mayor for asking me to be part of the work. I will pass it to Jake.
Good evening, everyone. I'm Jake Langlis, Superintendent, Lewiston Public Schools. I've also been in Lewiston for some time. Prior to my somewhere around 13, 14, maybe 15 years in Lewiston Public Schools, my wife and I ran a home, a therapeutic foster parent home for students that had some needs. So I'm pretty familiar with those very close to poverty, and also the idea that education can be a pipeline to freedom and independence that we want to build. I will pass it to, who hasn't gone yet? Jolene.
Hello. This is my first meeting as well, so I'd like to thank the mayor for inviting me. I'm Jolene Bedard. I'm Executive Director at United Way, right on Ash Street in Lewiston. I've been with the organization for 23 years and also worked at the Red Cross locally as well. We've done a lot of work around poverty, and I've participated in the Bridges Out of Poverty workshop. So I'm just really excited. It was great to read the literature that the mayor sent. So again, thanks for inviting me, and I'm happy to be here.
And let's pass it over to Elizabeth.
Thank you, Mayor Kerr. I'm Elizabeth Keene, Vice President for Mission Integration at St. Mary's Regional Medical Center in Lewiston. I grew up in Auburn, graduate of Everett Little High School. It is a reunion year for me. I won't tell you what year it is, but it has been a while. I did start off in healthcare in Baltimore, where I was for 14 years, but I've now been back in Lewiston for 12 years and delighted to be here at St. Mary's, and was really honored to be invited to serve. This is my first meeting as well. I have participated in some of the Bridges Out of Poverty training, and have also been involved in some of the choice grant work, which I think will dovetail nicely. And I've also had the joy of working with Dale quite a bit these past few months on some of the vaccine clinics.
All right, let's turn it over to Representative Connor.
Thank you, Mr. Mayor. I am the rookie on the panel. I grew up in Lewiston, went away, joined the service, and came back 20 years later after retiring, and decided to get into politics for whatever reason. But so yeah, I represent House District 58, which is the outskirts here in Lewiston. So thank you, Mr. Mayor, for the opportunity, and looking forward to working with everybody on this issue.
All right, thank you. And Dr. Picker.
Yeah, thank you. First, I say just call me Bethany, please. But I am a family physician. I work at CMMC. I'm the program director of the Family Medicine Residency. So work with medical students and residents to finish off their education. I've been here in Lewiston for 15 years. My kids went through elementary school here in town, so and I'm really excited to be on this work.
And last but not least, the famous Fatuma Hassan.
Thank you, Mayor. Thank you. Thank you for the invitation. It's my first time also to be here. My name is Fatuma Hassan. I'm with the Immigrant Resource Center of Maine, and have been in Lewiston and Auburn. For those of us who want to lift up Auburn as well, for 20 years. And I've been all over the place, but I just want to say that I'm appreciative about, what I'm appreciative about this committee and this work is it's very close to the people that we serve every day and the families that we work with every day and the children that need to be lifted into a whole different direction for Lewiston and its community. And so I'm very, very appreciative and proud and really will do whatever I can to add to this work. So thank you, Mayor.
Oh, you're very welcome. Thank you. I think we've got everybody. Did we miss anybody? Okay. So, you know, in the decade-long process of serving our community, I've always believed that society dumps so much on our schools. It's like whenever there's a society ill, we turn to the schools to solve that. And then somewhere in that mix, we expect them to educate our children as well. And when schools struggle doing that, carrying that weight of society, in the end, education suffers. I've also felt that we have incredible nonprofits in our community, and they all do such good work, but rarely do you see the common goals so that people are focused on areas and then measurable results. Very challenging to see. So that's, you know, when I became mayor, I just said, well, I have one chance to maybe make a difference here. But I recognize that me as a person was not going to be the one that made the difference. It was going to be the community. And when you look around this room, I'm just so impressed. We have so much talent sitting right here. So I look forward to the work, and thank you everybody for taking time to introduce yourselves. With that, the second item on the agenda is establishing our meeting schedules and times. Most people here are pretty fortunate. They're here with the blessing of either their employer or they're the boss, one or the other. So, you know, we have options here of days, evenings, whatever the committee feels. So I don't think we have to limit ourselves. So with that said, I'd just kind of like to hear other folks' thoughts on timing of the meetings. And I'm thinking, you know, every 2 weeks initially, and then it may be, you know, then it might be able to shift to a monthly meeting. And we only have 6 months to get the work done. So it will be, you know, there'll be a lot of work going on once the working groups start producing. So any thoughts on best times and dates for meetings?
So the one thing I just want to mention, and you certainly don't have to plan around us, but Rep Connor and I are going to be heading into a pretty intense legislative schedule between June 1st and June 17th. So if we could schedule maybe our next meeting after that, that would be helpful to us, I think.
After the 17th.
But beyond that for me, yeah, beyond that for me, days or evenings are open.
I echo Representative Cloutier.
Okay. Anyone else have some thoughts they'd like to share? Is there anyone that would really struggle with daytime meetings?
Mayor Care, what's the time of the meetings as far as the duration?
So I'm hoping most meetings we can try to keep to an hour and a half, 2 at the max.
Okay.
And I'm pretty strict when it comes to, you know, if we say that we want to be out of here by 7:30, I'm going to really try hard to make sure that we are, so that people can count on that timing.
I would appreciate daytime. I don't know about everyone else, but it's hard to manage kiddos after.
I'm going to piggyback on Tanya's statement. As a superintendent, of course, everybody on the screen works tons of hours. If we can figure out daytime, that may be easier for me so I can see my family some evenings. But this work is important enough. If we can't do that, I'll make myself available.
Okay, does anyone, so is everybody okay with day meetings? Can we get a thumbs up with people who, for the most part, could work out a day meeting? Bethany, what's your concern?
Well, it's a 2 hour in a day. It would just depend. I can make it work. I'm just not sure I can make it work all the time.
Okay.
But I'll give it a go. I'm happy to work with it and see where it goes.
All right. And I think most would be like an hour and a half, but you know, I think once the working groups start producing, it may take a little bit longer. And we as a committee control our meetings, so we can, change that. So days of weeks, days of the week, Tuesdays, Wednesdays, Mondays, does anyone have days that would definitely be out?
Tuesday would be out for me.
Mondays do not work for me.
Okay. Do Wednesdays, would that work for the most part?
Some part of Wednesdays for me, but.
I'm sorry, Wednesdays.
11 to 1 window is tricky for me. I have some standing meetings that are pretty hard. But as we spill in the summer, there might be some more flexibility.
Okay.
And Mayor, I was gonna suggest if we're doing day meetings, can we maybe do something like early morning type of thing before? Because I think a lot of us do have very much packed day throughout and a lot of different meetings.
Okay. Is early mornings better for folks? Does that work? Okay, can I get a thumbs up if that would work for most people? And, I'm talking 5 a.m. So it's,
I was gonna say, define early.
Yeah, because my early, I can assure you, is different than most. No, I think we would
It's very
shoot.
relative.
I would shoot for, 8 o'clock, most probably. All right. So some folks have a problem with Tuesdays and some with Wednesdays. Would Thursdays work or?
Thursday actually does not work for me.
Okay.
We have standing staff meetings at 9 on Thursdays.
All right. So, I think Wednesday did seem like the best day. So Superintendent Langlis, go ahead.
Just curious if mid-morning would be better, although Karen and I, if we have to, we can split things up if it's needed.
So you're talking 9, 10 o'clock?
Yeah, that would be better for me. But again, I can make it work if it's first thing.
Okay.
I just have a board meeting the second Wednesday of every month.
What
So
time?
if we alternated Wednesdays,
Say that again, Kristen.
if we alternated Wednesdays, so if you're thinking of doing every 2 weeks, we could do it on the off week for Jolene, right?
Yep. Yeah, we can make that work.
Okay.
So Marcella, have you been taking notes generally? All right, so what we'll do is we'll put out a 6-month schedule. And then if folks can look at it and if there are major issues, that'll give us time to be flexible. And then just keep in mind, if folks miss one meeting, that's not an issue. We're gonna encourage people to try to be at every meeting, but we understand everybody's got lives, we're going into summer. So if there's an occasional miss of a meeting, don't feel that that's gonna be a major issue. All right, so we'll put something out for the committee to look at, and please be upfront and honest if there's a date that just doesn't work for you, or if the process, the pattern that we've designed doesn't work for you, please speak up. And if it's just one date out of all, the 6-month schedule, like I said, we're going to be very flexible with folks. All right, any other comments, questions, or concerns, Kristen?
Yeah, so I hate to be the person to ask this, but are we planning for Zoom meetings or in-person meetings?
So again,
We are open to have that conversation.
Yeah, no, at this point, we're planning Zooms because I think where everybody's most probably going to do it from their workspace, it just might be easier. And then maybe towards the end, we get, have one meeting where we all get together or something. But I'm really open. I mean, this is your ad hoc committee too. I mean, I pulled it together, but it's our work. So that's what I'm leaning towards. Okay.
And Mayor, just one last thing. Like Jolene, I have a standing meeting the 3rd Wednesday of every month, which is a commission meeting that I can't miss.
Okay. I see Marcella's noting that, so we'll see what we can figure out. Like Bethany, I would just encourage, please feel free to call me Mark. We're going to spend 6 months together. So, all right, thank you. Okay, so see, we're already past agenda item number 2. So item number 3 is a brief presentation by Bill Grant to the committee on the work of the Lewiston School Department Subcommittee on Poverty. So this is just an opportunity to hear it from somebody who was actively involved in the work, and Bill does a really great job presenting. So Bill, if you're ready, go ahead and take it away.
You could have waited until after and said, great job presenting. So I better not flub this, but I'm going to screen share if that's okay with everybody. And this is the presentation that we initially gave to the school committee. And it just kind of highlights some of our work and gives you an overview of the history of our committee, how we came about, and then how we came about to the goals that we got to, and then ultimately just kind of some of the reflections we had on it. So folks are probably aware that when Mark was the school committee chair, he had commissioned this subcommittee. And the charge, as we came together as a committee, was to assess and adapt the Harlem Children's Zone to Lewiston by creating and implementing with community members a city effort to reduce the impact of poverty. And of course, I can't see my full screen here because I got people on student success. And then what this work would likely include, and that's what these bulleted points are. So you know who was on the committee. These are the committee members, and some of them, well, actually, no one's here today. But the people that had stars by their names are folks that went to the Harlem trip. This was the very last trip that many of us took. It was in January of 2020, and we were in New York City, had a great time, and learned quite a bit about the Harlem Children's Zone. So when we went down to the Harlem Children's Zone, they have a very specific agenda. It's called the Practitioners Institute, and you have to apply for it. We applied for it, and we were granted the ability to go down there. It was a 3-day trip, and we chose kind of the early childhood area of things. And the way that Harlem Children's Zone works is they actually are very holistic in their practice. And it's from, pre-birth all the way on up to college, and working with students. And they work with parents along the way, which was obviously the interest for me, being the adult educator on the trip. But they have a very specific way that they go about and decide whether they're going to do programming in their community. And they have these 5 guiding questions that I have up on the screen that they go through each time they're looking at implementing some new structure. And they're very, very data driven. So once they answer these questions, is there a need in their community? Who are the stakeholders? And how do we galvanize those stakeholders? What the obstacles are? And then actions can start modeling now. Once they get those together, they scrutinize what they implement and decide whether they're going to continue with it in their further practice. It was one of the things that really kind of captivated me in visiting this was almost every presenter kind of talked about it is there's this huge problem and we take it bite by bite. And that's what we've done for many, many years. And we've had, great impact on our community. So when we all came back from this, we started really kind of the work of, okay, what are the recommendations we're going to come out of with this? And how are we going to do that? So we were fortunate enough to have a facilitator that helped walk us through the process. And what I have up on the screen now is actually the end result. And it was not very easy to come to this, particular shared result. But this is what the committee came up with, a shared result. And the Lewiston community/schools ensures children are ready to learn and have equitable, measurable outcomes. So the questions really were, how are we going to get there? And that's the indicators of progress. And this is kind of something I believe the mayor in his letter that he put out, or Mark put out to us, that you saw these indicators of progress. But these indicators of progress, we really landed on that early childhood indicators. The reason we did that is from kind of looking at data and best bang for your buck is the earlier you put an intervention in with kids, the more apt that you're going to have further results down the road. So we came up initially with 3 indicators: number and percent of children living in poverty in Lewiston, number and percent of children in Lewiston who demonstrate readiness for kindergarten, and then number and percent of children who are at 3rd grade reading level. And for some folks, you might wonder why we chose the 3rd grade reading level. And I think the simplest answer for that is at 3rd grade, at the end of 3rd grade, you're no longer necessarily learning how to read. You're using reading to learn. So that's why that particular benchmark was so important. We used obviously data to inform this, and I'm just going to kind of click through these, but highlight a couple things. One, you'll notice in this particular thing on the child poverty, we do have a downward trend in our poverty in the city of Lewiston. However, we're still way above the statewide average, and we're also really disproportionate when you look at the demographics. As far as kindergarten readiness, I think one of the biggest things here was for our group building on systems we have in place. So we have quality pre-K programming in both the schools and with our Head Start program, which is in Lewiston Promise Head Start. And so we wanted to make sure that we were having consistent data measures, and then that we were that with those data measures, we were then saying, okay, what defines somebody that's kindergarten readiness? Kristen, did you have a question?
Thanks, Bill. So the data for this slide is from Promise, correct?
Correct.
And the data for the previous slide, is that also Promise, or is that from somewhere else?
That's not Promise. That's from Census Data. So my data partner, Heidi McCarthy, who has been great through this process, and I'm sure Heidi would allow you to reach out to her. She really was our person to pull data and then kind of like match it back and things. But what you're seeing here, I just clicked back on the poverty. That would be kind of the census data, not the latest census data, right? It was the previous, and then this came from the Promise.
Great, thank you.
Yep. This next piece of data came from our school data. This is available. We can get it through the school, but you can also get it through the data warehouse through the Department of Education. And this looked at where our 3rd grade reading was. Just a couple things to note here and be aware of, and that our group was aware of. One, kind of that disproportion again when we look at demographics, but also in Lewiston, we have had a historical problem with students opting out of the test. So parents saying my kids aren't going to take that particular assessment. And so that really does have a big effect on reporting out in 3rd grade. In our poverty group, though, we said, that's one of the things that the community can impact, because the schools have to kind of give an offer of opt in or opt out. But if our community is saying, look, you can do that, but do you realize the impact you're having on it? Then hopefully we can do something with the opt out. So once we have these indicators of success, go ahead, Fatuma.
Just quickly, I don't want to assume this, but when we say opt in, opt out, are we talking about probably the ELL program and some of that?
No, we're actually talking about specific state testing. So that would be like the MEA testing.
And the access testing?
Not the access testing.
Okay, because that's not an option, right?
I got the superintendent here, so he can answer that one.
Right. Never mind. Thank you. I just wanted to clarify. Thank you, Bill.
So
Yeah.
the Test is considered a state test for our ELL students. And so, yes, parents do have the option to opt out of that. We try to work really hard to educate and help our ELL families understand the importance of it. But yes, access is considered a state test. I don't believe that's reflected in this data, though. I think it was just the MEA data that was looked at.
Thank you.
That is correct. This is complete MEA data. And again, we're getting that indicator, which is, you know, that reading to learn versus learning to read. So once we had the indicators of success, we then had to say, okay, how are we going to get to those percents or numbers? And our facilitator took us through, and now you have to develop targets. And the targets, if you read the report or you take a look at the report, they actually refer to the targets as targets to time. So what are we going to do in a time period? And so in January, this is the targets that we presented to the school committee and that we were looking to meet. So for children in poverty, we had to be specific as well. 91 fewer children ages 0 to 5 will be in poverty, and the 0 to 5 rate will decline by 12%. With the third grade reading, again, we were specific and kind of looked at both things. We wanted 36%, or put a number on it, 39 students that didn't meet or only partially met to meet or exceed, and then also a minimum of 20 of those students being students of color, which our data pointed to demographics. And then the final was the kindergarten readiness. And the kindergarten readiness, I kind of had in my mind a preconceived thing, like we do a kindergarten screening every year, like, and I was thinking like, okay, you know, it's going to be how many kids can balance on one foot, know the alphabet, things like that. But really, our K and pre-K specialists sat down and came up with some, actually, what I've found to be better indicators of the readiness and targets to get to. So that's 100% of all of our incoming kindergarten students have the identified medical home. 80% of the incoming K students will have an identified dental home. So again, you know, we're not just talking education here, we're talking health. 85% of the K students participate in or have access to supportive quality early learning programs. That's our 4-year-old programs. And that, you know, we're kind of looking at how many actually access that programming and did it make a impact in their readiness. And then increasing and getting up to 85% who attend those pre-K programming. And you'll see some kind of jargon in here, but teaching strategies, gold standards, those are what the professionals use to measure things. So we have our targets, we have our indicators. All right, now the work kind of begins. What's our recommendation for that? So we came up with 4 areas of focus for collaboration, so for this work to happen in our community. The 4 were coordination of service, equity leadership, basic needs, and individual supports, which in these next slides we'll look at a little bit deeper for each one. So coordination of service, really create a structure, and it's about increasing collaboration and collaboration around those 3 indicators. So again, it's getting all stakeholders to be focusing and taking ownership in. If the 3rd grade reading level doesn't go up, we all are taking ownership in that. And we're also taking ownership in getting to that target. So what are we doing to increase that reading? Fill gaps and eliminate barriers to service and deliveries. This is really for our community members, that we ensure that barriers are being addressed, and we're doing things that we can to eliminate those barriers. And evaluate and deploy resources to maximize impact and outcomes. And the key word here was the evaluation and of the impact of those resources. So we're evaluating what resources we have and their impact. Equity of leadership. So this area was really kind of looking at how we are as far as leadership in our community and how that matches our what our community's demographics are. So we wanted to address the fact that what are we doing to foster, diversity and equity in our workforce and building leaders so that when you see leaders in our community, they ultimately match what our community is made up of. And then basic needs. This is kind of into those barriers of things, but we want to look at what those basic needs are and then address those in a way that's going to be, across the community. And when I think of this basic needs, I actually, I think it was Elizabeth that mentioned the choice grant. And that was something that was just awarded. So, we presented this back in January and we didn't have that. But now, when I see this affordable housing and stable housing, I'm really starting to see like, hey, we are kind of working towards that, especially now that we have this choice grant. And then finally, individual support and services. This was looking at what kind of things we might need to put into our community to be able to battle poverty. So one of the things that kept rising to the top was family navigators, and really those navigators helping people in the community navigate all the services. And again, I think that kind of goes, you can see how all of these are linked, but that kind of goes back to the resources. And as we evaluate the resources, these family navigators could really leverage and ensure those resources are used. And also kind of that single point of contact. It's such a difficult thing to navigate systems. And so how do we start to develop a single point of contact? So the final thing that we came up with in this, of course, I was going to say it was my favorite slide. Here it is. It keeps wanting to skip. So this slide was a great thing for me to see this graphic because I always went back to this. And one of the things about this graphic is I always felt you could take things out and put things in. So going on what I said about the Harlem Children's Zone and that they take one bite at a time to really solve a huge issue, that's what this was. So we had to come up and we had to get very narrow with our targets. But if you were to meet third grade reading and we exceeded that, we would know we didn't solve the whole poverty problem. So we need to be looking at something else. And so you can add to this middle area, this like kind of turquoise area. And actually, I think we're going to talk about in a minute, the mayor, as he put the ad hoc together, we had a glaring one. While we focused on early childhood, we know we have a real issue with students persisting and earning a diploma. And we have a high dropout rate. I always hesitate using the word dropout as an adult educator, but we know that we have a high dropout rate and we need to address that. So you'll already see that while this was our recommendation, we know we had that glaring thing of a dropout rate and we need to get people their high school credentials. So that's something that was added on here. But this graphic is helpful, especially if you're reading through the report that we put together, because it kind of just gives you that good picture of what we've done and our recommendation. And then, finally, just some reflections. I think I could sum this up by just saying we realize to solve these things, we have to do this together. We have to collaborate. It's so great to see many leaders of organizations here tonight and local and state government, because we have to work together on these things. I think the mayor said in his opening statements that it does fall onto the schools And if we start to share some of these indicators and some of these things, that's how we're going to start making differences, and that schools better, but ultimately that's how we're going to make our community. The final thing, and this is kind of that disclaimer, I believe, for our committee, but our subcommittee only had so much of our best thinking, and that could definitely be a limiting factor of the things that we came up. But ultimately, I think we felt good about what we came up with, and that these targets that we put together are definitely things that we should be working on to better our community. So I think I can stop screen sharing. I see a hand. Yeah.
Hey, Bill, the mayor was right. Great presenter. I had a question back on your census data.
Yep.
On the, I think it was the first graphic, the number of children in poverty in the city. I think it's 658. Is that number of children, or is that households? Do we have that broken down by households? Would that be a good number to get?
We could most likely get households. The data we did, it was actual children, and that just kind of went back to our target, because we were saying a specific number of children out of poverty. So, but that 658 that you referred to is children. I'm sure we could get household.
And one of our concerns is the census is not, although everybody relies heavily on it when it comes to funding, in Lewiston, poverty is seriously underreported in the U.S. Census, because we have many families that don't take part in it. One other thing I want to add to Bill's presentation. So if we identify if one of the working group identifies ways to improve kindergarten readiness, that does not necessarily mean that we're going to reduce poverty, but that's the pipeline to families in our school district that in most circumstances, not all, live in poverty. And if we can identify ways to fund family navigators, not on the backs of schools, not on the backs of taxpayers, but utilizing all our community partners, if we can identify ways to provide that helping hand to families, and notice I use that term because society criticizes social services and say, we should be providing helping hands. And I agree with that sentiment. If we can provide that helping hand to families to get them out of poverty and have it be sustainable. So right now, the federal government counts benefits. So if they pay SNAP benefits, and now that pushes somebody above poverty limits, they're no longer in poverty. And that is a poor way to address poverty as far as I'm concerned. We need to help families sustainably stay out of poverty by providing education, substance abuse treatment, all the things that hold people in poverty. So I just wanted to add that, because I know as I was part of it, and as I listen, it's I always catch myself saying, but that's not going to reduce poverty, but it will, because we'll find the targets that need our help the most. So any other questions or comments for Bill, Tanya?
Yes, thank you, Mark. So Bill, great job with that. I appreciate the overview. I have a lot of questions, but I'll go with one in particular. So on the slide where you presented the targets for kindergarten readiness, it's kind of broken down in how I saw it, like medical, dental, education, right? Kind of three really tangible things. So I'm just wondering where the social emotional support is, because if we keep, my thought around that is, if it's not named, then it will fold in under something else. Like, you can't expect a family navigator who doesn't have that training and expertise to be able to support a family from a social emotional standpoint in the way that they may need. I mean, I think we have generational poverty in Lewiston, and a lot of that does stem from, trauma and just that overarching impact of being in poverty for such a long period of time.
I think that's a great question, and I can definitely say, we were when we came up with these targets, we continued to narrow them down. So it almost does have kind of that feel of, this is how this is how somebody should show up to our doorstep ready to learn. And we're not necessarily taking in that social emotional piece. I think if we had the pre-K folks and K folks in the room, what they would say is those gold standard teaching standards do address some of those social emotional things, and that they would be meeting that particular thing. I don't want to go off on an editorial because I happen to have the experience of one of my sons was in a Head Start classroom, and it needs a balance to do it, but you've got to meet these social emotional things. You've got to meet these family participation things as a parent, and it can be prescriptive. But I had a lot of time. I actually talked to Betsy Norcross-Plord quite a bit on the trip to Harlem, and I was explaining that experience to her, and she was saying how they do it so it's not prescriptive, and it's more of, this is just to help everybody connect better and get the resources they need. But it isn't explicitly named. I think you have a great point.
But it will be, because as we bring these working groups, that's going to be a perfect and again, remember, that's what this ad hoc committee is for, is to really kind of watch this process work out and make sure that we're covering all the bases. So thank you for bringing that up, and we'll make sure that we discuss that with the working group in the coming meetings. Elizabeth, was there anything else, Tanya? I'm sorry. No. Okay. Thank you, Elizabeth. I'm sorry.
That's okay. Just to build on what Tanya and Bill were talking about, I do think a trauma-informed lens over all of this would be important wherever we're coming from, medical, social service, education. And so, for example, with what was listed there for every child having a medical home, so I can just share, I also have the privilege of serving on the board for community clinical services. And so our CCS pediatrics practice does screen children and families for the adverse childhood experiences. But then also looks at, okay, then what are we going to do about building resilience and ensuring that there are protective factors for children to address some of that support. So I'm really excited about bringing all of these efforts together and seeing how we can collaborate comprehensively.
A question directed at Bethany and Elizabeth. So how difficult will it be that, one, I'm not sure we understand how many children in Lewiston don't have medical homes or dental homes, but how difficult will it be to identify that and then find ways to make sure we provide that? Do you have any thoughts on that?
I know probably a little, just enough to be maybe dangerous about some of it. So for example, I know there are some specific requirements for children to have some sort of dental exam before pre-K. So our CCS pediatric dental practice actually does serve a lot of children in that way. And just this past week, actually, Dr. Tyler Gagnon from that practice partnered with Promise to do some dental exams for kids so that it'll help them be ready for the next school year. So I think that part's great. And as a FQHC, a federally qualified health center, we have to do many, many statistics about our patient population. So I do think we will be able to pull out how many children in our community have the medical and dental homes and where the gaps are. I think we will be able to get that data.
Okay. Bethany, do you have any thoughts on that?
Yeah, I'm less familiar with how to get the data of who might be without a medical home, and more confident saying that we here, at least at the residency and in CMMC in general, but the residency really would welcome many more kids and young families into our practice and have the room and capacity to meet that need.
All right, good, thank you. Fatuma?
I think I want to bring the demographics and race into this conversation, because I think there's something about being poor and poverty. So that's that's what we're talking about. But I think when you sort of start peeling, race and and generations and generations and generations of Black and brown communities here. I think those are things that really even affect you much more. And so I, as we were talking about research and data, I wonder if the USM does have a very robust center around statistics and data and a lot of these things. If we have the data, great. If we don't have the data, then do we look at ways to really partner with folks who have this expertise to really help us gauge? I, for one, who's a mother who has children, and I know my children are very much privileged, really want to dedicate a lot of effort into making sure that our kids have access to healthcare, access to education, and progress in life. And so I think some of these things are going to need to have deeper conversation and looking at them so that we can get the appropriate tools to get us into a place that we're informed about what the issue is so that we can find solutions that can really solve those issues.
Okay, thank you. Elizabeth?
Just very quickly, for the choice grant, we actually had to compile much of this same data for the children in the choice neighborhoods. And so that will be a great resource for us. And Bates College actually helped us with that data as well. So we will have access to some of that, which will be helpful.
Okay, great, thank you. Any other questions or comments in reference to Bill's presentation and the work of the subcommittee so far?
Would Bill be willing to email that deck tour to everyone, please? Thank you.
Yep. And I believe I'll email to the date that we did the presentation to the school committee, because I think all of the documents are in that particular packet. So.
Thank you.
All right. Anything else? Okay. So agenda item 4 is just to kind of discuss the mayoral order. Has everyone had an opportunity to read through that? Yes. Okay. So what, I took the liberty, like Bill said, just to throw on graduation rates, because I just felt that that was an area, and I did get the superintendent's permission to do that. I just didn't do that willy-nilly. But I just thought if if we're identifying working groups are going to bring our partners together to work on this, why not take the opportunity to work on graduation rates? And again, go ahead, Superintendent Lewis.
I'll just add, I've been connected to numerous efforts to try to boost graduation rates and find ways and pathways and unique ways to get kids to cross the stage. And I tell you, I'm a bit of an emotional guy, but every single one of them I've watched walk across the stage, that knowing them from a younger age, I thought they might not, is the most rewarding thing we can do. And if we can make these differences at a young age and look up in 12 years, 10 years, 9 years, whatever it is, and know that our efforts help contribute to the well-being of our kids and that they were able to achieve a diploma and carry that proudly with them, that is the payment. That's the fruit of this. And so I wanted to share that with you. So when Mark shared it with me as an idea, as a capstone, as a strategy, as a celebration, I think it's perfect. So thank you for bringing it up, the idea.
Thank you. And Jake, could you talk a little bit about the 5-year students and how that affects our numbers that, are really not being treated fairly by the state?
Well, I could talk about things I think are fair and not fair from the state all day, but we do have a number of students who cross that finish line, if you will, in their 5th year. And there's realistic, reasonable barriers connected to our demographic, from poverty to language learning to generational poverty to generational not finishing school or non-completers. And so we have a number of students who do complete in that 5th year. It is not a data set that the state uses for calculations, or, in my world, when we see the article come out in the paper and they're giving schools a letter grade or a percentage of dropouts or success rates, If students don't complete high school 4 years from when they enter, they are considered not a graduate. And so that's the data set. We do have a number of students who graduate in that 5th year, and it's not calculated. Not in that public sense. We do have the numbers, but we have a number of students, and I'm proud of that 5th year number, to be honest. I'm also proud of our students who continue and say high school's not great for them and complete their high set and credentials through adult ed. Those are students who have been more resilient and in my opinion, found success in ways that other kids didn't have to struggle to get there. So if anybody can make mention of that in the state, I'd love to have more.
And I mentioned the state, but is that more of a federal DOE rule, or is that a state rule? Because I don't want our representatives to feel that was a slam to them, because we know the hard work they do here. But
well, and I don't think Representative Connor or Clea are connected to that process. It's just it's a module, and they use a 4-year cohort, and that's just how it equates, and everybody's familiar with a 4-year cohort. And so I'm not trying to slam anybody by any stretch. It's an equation. It probably does have some federal alignment, but it's also very familiar to all of us, because high school was likely a 4-year process for many of us. And that's something that people are familiar with, so they use it as a metric.
all right.
I just want to, I have to add in here a little bit, and this is probably something for this committee to kind of, chew on, is that's going to be something that's going to be, we're probably not going to change that 4-year cohort thing. That's just, that's just a federal systemic kind of a thing. And the question is, are we valuing more the credential? And so do we recognize in our numbers? So the newspaper article comes out and says the graduation rate is whatever, but do we follow that up with, as a community, and put in those 5th years and put in those folks that took the adult ed pathway and place value on that in our community, even though systemically, the system says that's not how we count it. And I think that can have some community buy-in, but I just kind of pose that a little bit there of, does the community want to recognize that?
Well, can I add another piece, Bill, that if we don't, there's like, I want to direct or indirect shaming of that student who's reached their 4th year of high school, who might say, I know I can finish this in the fall, but I don't want to do that because my community shames that. It's embarrassing. I don't want to be part of that stigma or that stereotype. So I will actually choose to drop out of school and not finish something I might be very close to avoid that stigma or that stereotype. Whereas I think we have an opportunity as a community to lift that up and celebrate that they achieve that milestone.
Yeah, that's a really good point, because we could take control of that as a community and make sure when we celebrate graduations that we recognize those numbers as well. And that really could set the tone for, folks at the Department of Education paying attention to that. And maybe understanding there's reasons for that change at some point. Tanya?
Thanks, Mark. I was while Jake was talking, I was thinking about, we see the same thing at Bates when a student doesn't graduate in 4 years. The family is just like, they're devastated oftentimes, like, oh my gosh, like, this is terrible. I'm like, well, it's actually not. Like, if your student's not prepared to go out there after this 4 years, wouldn't we give them that 5th year so they can feel confident when they leave? Because it's going to be a measure of success when they enter their professional capacity or go into grad school. So we're working as a college to address that with families as well. And I don't know if those graduation rates in that 4-year gap is the same with higher ed. I don't know, but I know that we as a college community are really looking at that and trying to calm parents and really say, like, it's more about the quality experience that your child has had here and their readiness to leave, opposed to you need to do it in 4 years, because whoever said that person is no longer here. That's just what we've been doing because we've been doing it, but not everybody learns the same. So I really do hope that the community takes a good hard look at that, because I think that we have a lot of kids that are right there and they just get so demoralized and quit.
Yeah, and I feel bad for our educators because, you know, when they look at the graduation rates that don't count the 5-year degree, it looks terrible. And when you add that, we're compatible with the rest of the state. So I think that's a great discussion to have at some point. All right.
Can I just add one more thing to it? Can I just add? I want to just really amplify what Jake is saying, which is, I think the students work so hard and the teachers work extremely very hard. Yet this box that we're in, that we put in, doesn't relate or measure the realities on the ground. And so as a kid who's already struggling a lot, when these kids are pushed through a system that they're not necessarily ready for, and then they'll go to college level education, it's much more harder to survive there. And so when you see many of our students give up or do other choices, it's because of the underlying issues that we have, whether it's being poor or substance use or mental health issues, just a bunch of different things. And so what I'm getting at is, as a committee and as a community here, is there an advocacy role, an education role, and a role that we need to play to both support educators and students, and also try to erase the stigma that that kid has and their family have when they don't graduate in a 4-year standard thing, whatever that thing is. And so I just want to make sure that people are aware of the implications that it has both on the student, on the educator, and the family.
All right, thank you. Okay, so in discussing the Mayoral Ad Hoc Committee, I really kind of like to stay focused on the working group still for a few minutes. So we're going to have a total of 5 working groups. Working group 1 is really is going to be focused on reducing poverty, and we've got some great people on that. Sean Yardley, Fahauza Musi, did I pronounce that right? Okay, thank you. I'm not really good at that sometimes. And then Heidi McCarthy. Sean Yardley leads probably the biggest nonprofit in the community, and somebody can correct me if I'm wrong. And they do some really good work around poverty already. And Fahauza also is part of a nonprofit within our community. And then Heidi McCarthy works in our community development department here. So they're going to be the leaders of that group, but they're going to bring in folks, other folks who are providing services around poverty, and then also folks with lived experiences, and then hopefully some elected officials or city officials and school officials. And that's going to be the breakdown of the working groups: some elected or city officials, people in lived experience, and then the people actually doing the work out in the streets. And then groups 2 and 3 have been merged, and that's kindergarten readiness and 3rd grade reading. Monica Miller is a Lewiston Public Schools educator and is focused on pre-K, that Monica's primary responsibility is?
Yes, Mark.
Okay. All right, thanks. Betsy Norcross-Plood, who's the director of Promise, and then Amanda Winslow, who's a principal over at Farwell School. Graduation rates: Bill Grant, Julia Sleeper, and Joseph Philippon. And Bill is so well known in our community. He runs adult education in both Lewiston and Auburn. Julia Sleeper is a rock star, but boy, she's a pain sometimes. And I say that jokingly. Julia is very passionate, and she just does some incredibly good work. So I'm anxious to see what comes out of the graduation group. And then Joe Philippon, everybody I believe knows, is a local police officer and just somebody who really cheerleads our community. And then the funding group. So I think the first 3 groups that I just spoke of, with 2 and 3 being together, is pretty self-explanatory. The funding group I'm going to be part of, Bobby Avery was, so I have to find somebody to replace Bobby. And then Monique Roy, who was a chair of the Lewiston School Committee at some point, and she's now an adult educator in Augusta. But the goal here is to reduce the financial burden on schools and the city. So my goal is to find outside funding sources that can fund the work that this group does and takes it off the property taxpayer. And I know that I hope no one sees that as a negative tone, trying to take it off the backs of the property taxpayers. It's just, we have organizations out there investing millions and millions of dollars into reducing poverty or improving student results. And we just need to identify ways to take advantage of that and get them working together. And the ones that we have listed so far, they're ready to go. They're ready to work together and identify goals, and then also share their funding sources. So, so that's kind of the reasoning behind that. This group really is going to have to monitor all that work and make sure that we hold folks, and I'm going to use the term accountable. These folks are hard workers. We're not going to have to hold them accountable, but it's going to be our responsibility to make sure that the product that they're putting out there for everybody meets the needs of this community and meets the needs of the Mayoral Ad Hoc Committee and their report. So that's just kind of an outlay of, you know, the Mayor Ad Hoc report charge, and then the work that's before us. Tanya?
Yes, thank you, Mark. So can you speak, when you mentioned working group 1, you mentioned that they're going to be having folks with lived experience kind of share out that will, I'm sure, inform some of their work. Can you speak to how they're going to recruit those folks?
So I don't know, because every individual group will do it themselves, but I'm assuming like Sean Yardley has access to folks that he works with every single day. Julia Sleeper, same thing. And then Betsy Norcross as well. So I think these folks are right around them.
Okay. And I think we can talk about this as we, you know, I don't think it's necessarily an accountability measure, but I know that, you know, when folks share from a lived experience standpoint, they can tend to be over-tapped in doing that, and we can cause harm. So, you know, again, I'm here from a social emotional standpoint, so I always think about that and making sure that we are not almost seemingly like voyeuristic, like give me a glance into what you're experiencing or what you have, and how far removed are they from that, because it could be re-traumatizing.
Yeah, so I think I can say this publicly because she's mentioned it many times. Shanna Cox has lived experience in poverty, so we're looking for folks that can help move the dial here. And it doesn't necessarily mean we're pulling, you know, someone in just because they're poor. You know, I think we've kind of had these discussions. I expect that, you know, we're looking for folks who are going to be able to be part of the team, and their lived experience will help us work through this in ways that's equitable, you know, that we're considering their thoughts. And that's not a great answer. I'm just trying to be honest. But what I do think is important, you're right, accountability is not the term to use, but we need to share this stuff with the working groups. And then if they have barriers finding people, you know, we're here to help them through that process, I hope. And I know you'll keep us on track in several areas. You have with the equity committee, and that's why we're all here to do that to each other. So thank you. Kristen?
Thanks, Mark. So yeah, I guess I just want to second Tanya's concern there, and maybe make the recommendation. You know, Shanna was deeply involved in the choice planning grant, and I know that a lot of their process was around, you know, sort of grassroots and sort of building that plan around and from people in the community. And so I think that there's probably some strategies in place there that we might be able to utilize that so we're not trying to sort of, I guess, rebuild the wheel here. That those strategies are in place and they've been used in the community. And I think that there are ways for us to value and see if we start trying to be about who we're taking input from, and we're making sure they're like a certain number of degrees removed, then we're not really getting what we need. We're not really hearing what we need. And so I'm, thinking about ways that maybe we can compensate folks for their involvement in this.
Okay. Yeah, I'm not sure I agree on the compensation part, but I think that's worthy of discussion. But I definitely agree that, so Shanna will be presenting at our next meeting kind of the choice work, or I'm sorry, some of the work she's doing with Strength in LA. So I do believe it would be an opportunity to talk more about that. And I absolutely agree with both of you that no sense reinventing the wheel because we only have 6 months. So thank you for that. And again, the working groups short term, we're hoping to have systems up and running by the end of this year, and with the ability of allowing time for that to be expanded a little bit, because I think it's easy to say, let's get this done in 6 months, but I'm not convinced that we might not need a little more time. All right, so now it's kind of like open discussion for a few minutes. And Kristen, thank you though for all that, and Tanya, I think that's important to be reminded of that, especially myself. A little bit of open discussion or questions or comments from the committee. All right, well, Fatuma.
Mark, I'm trying to, what came to my mind is sort of the process that we went through with City Spirit and trying to develop the equity statement. I know we're talking about, so I get we don't need funding from the taxpayers and the city, but I'm wondering if there's a way to, and I know you are on the funding committee, but if there's a way to bring in a consulting group that is maybe not that expensive or expensive, however, and maybe we can all figure out how to fund that, that can really work with both this committee and the subcommittees to get us to a place where, then it can, I just feel like, if, the subcommittees, they probably may need some tools, whether it's the neighborhoods initiative that we've worked on, a number of us on here have worked on, Choice Grant, before it was Choice Grant, and a lot of hard work went in there. I'm on the LA, Strengthening LA initiative. So there's just a lot of different good stuff that's happening in our community right now. Bill is on there too, that I think can be pulled, but I don't know that we are able to do, can you see how I'm sort of being very careful, because I'm talking about funding or money, but not through the city though, Mark. I just want to be very clear about that. I think we can figure out other ways of doing this, but it can help us get into a good place of supporting the subcommittee work, supporting this work, and getting us into a better path.
Yeah, so, so I want to correct something. I'm not trying to say we shouldn't have any city funding or school funding. Currently, the city and the schools invest millions of dollars in poverty, millions and millions of dollars in poverty. And I think it's finding ways to identify the goals that we work with some of the nonprofits, so that our funding kind of complements each other. As far as this poverty subcommittee of the school committee worked for 2 years to draft this out without any consultant. I think they're ready to set up systems in place. I don't believe that we're going to need outside consultant, but in 3 or 4 months, if we see that it isn't working in that direction, then I think that's something we definitely could consider at the time. But I think these folks are ready to set up systems in place relatively quickly to actually start providing services to our students in short order. But good thought, and we do have to monitor that just to make sure we're moving forward. Kristen?
So we've been saying 6 months. Is there an end date in the charge?
There is November, I think 20 something. November 1st is the end date with a caveat that I can extend that, of course.
Okay, so I'm just thinking, you know, my day job is in the Harvard Center at Bates College, and we have students that the majority of folks I think on this call have had a Bates student that they've worked with on research or some kind of project. So I just want to, we're starting during the summer, and obviously the majority of students won't be here for the first part of this work, but I do want to offer up that as a possibility as we get sort of to the later stages of this. And if we are able to figure out a way, you know, I just want to go back to my compensation piece, because I do find that to be a really important piece to this when you're asking people to share their lived experience. That, you know, if we're able to find a space for students, that the Harvard Center also has grants that can be made available to provide that compensation, whether it's a gift card or, you know, something like that, just so that if we're conducting interviews and we're asking people to share that we're acknowledging that is, as Tanya said, taxing in a lot of different ways. So I just wanted to put that out there as another way for us to think about funding for some of these things.
No, I appreciate that. And I guess I look at lived experience a little bit differently. I'm hoping we'll find people with lived experience to be part of the creation of the implementation. So that's a good point on, you know, when you bring people in with lived experience, there may be some trauma issues. But I think we got to let the working groups do the work and let them identify what their needs are. You know, if they think compensation is the only way to get people involved, or so yeah, I just think let them start, and then hopefully they'll come to us with some of those issues.
Sorry about the dog barking. For me, it's less about incentivizing folks to come to the table and more about recognizing the value that they're bringing, if that makes sense.
It does, yeah. No, thank you. And thank you for bringing it up again. So, you know, maybe when our working groups present to us, we at least throw that out there for them to consider. And then, so that will open the door for them if they feel they need it. Okay, does that work for you? All right, Tanya?
Well, I first just want to echo, I 100% agree with Kristen on this one. I think, you know, from a lived experience standpoint, what we have to remember is that they're providing a service because we're extrapolating data from them. So we are getting something from them that may come with layers of, like you mentioned, like I mentioned, could come with trauma. They could be in a great place and maybe it doesn't. But the point is that we are benefiting from something. So we are in some ways consulting with that person. So I've seen this happen. It's best practice in research to offer some sort of compensation, even if it is in a small token of a gift card or something like that. But it's not what draws people in. And a lot of times people say, I don't really need that. No, thank you. They don't want it. But it's the fact that it's offered. So I think it shows good faith. But what I also wanted to ask is, in the working groups themselves, and I know a lot of the names that you mentioned, Mark, and what was shown on the slideshow. But if we don't have kind of a lot of diversity in those working groups, then we're really asking people to give us something we don't already have. So, and I think that's part of the charge, is to have a diverse group of people working on that, which I think we're trying, and that's obvious that we're trying. But I do hope that we recognize that, you know, you can kind of see just on the screen that we still struggle with that, you know, and I think that if you go outside in Lewiston, we're still struggling to represent what our community truly does look like. And a lot of times when we're talking about poverty, there are a lot of people that think we're only talking about Black and Brown children, and we're not. So I think that those conversations really just need to be truly diverse in nature. And then the last thing that I would say is to Fatuma's point, you know, I think the idea of a consultant is wonderful, but I'm going to agree with you, Mark. I think that we have to see what these working groups with our support can do, because if the community doesn't grab a hold of this and own it as our issue, then we can hire a consultant. We're just going to hire another one in a year. So it's just going to be money that we're just going to keep funneling for somebody to come in and say, you need to put your arms around your community and you guys need to work together, because that's what needs to happen. So I feel like we got to give the working groups a shot as well.
Yeah, and I have a lot of confidence in those working groups, but I've worked with them for 2 years. But I mean, there are many folks on those working groups much more intelligent than I ever will be. So I look forward to see what comes out of them. And again, I felt it was important to have an oversight, though. And I'm pretty one-sided sometimes on my oversight, but that's why I pulled together everybody in this room, because we need that. We need people to recognize that. Kristen?
Sorry, I keep jumping in here. The other thing that I've just kind of been thinking through is when you say not on the backs of the taxpayers, and I get that from a fiscal standpoint, I guess I want to reframe that, the word taxpayer to resident, and I want to, I guess, change the framing there to that. At some point, this becomes the work of all of the residents, right? Like it can't. While we won't be asking them to pay for it, like we have to be asking them to take responsibility for it at some point, because the work of changing this community is not going to happen with like the 15 to 20 people we have on the screen here right now, or even the maybe 100 people that are involved in this initiative alone. Like at some point we need to figure out, and maybe it's, one of the recommendations that comes out of this at the end, how we make this the work of this community as a whole, because every single person that lives here plays a role in that. And I don't think we can see it as putting it on the backs of somebody else. I think it's something that we all need to do in community, if that makes sense to folks.
Okay, thank you. All right, any other questions, comments, suggestions? Elizabeth?
Just wanted to mention that Community Credit Union is now a CDFI, a Community Development Financial Institution, which means that they can apply for grants specifically for addressing poverty and addressing how to support underserved communities. So I think that they would be very interested to hear about this work of this task force and to see how, especially with your funding committee, Mark, maybe they could assist, because they really have some great opportunities, including things from a fund set aside so that people can get no interest mortgages to emergency loans to other interesting options. So just wanted to make sure we were all aware of that.
Yeah, thank you very much. Because as you were saying that, I was thinking, because another charge of that funding group is trying to find a fiscal agent that can handle that. And I'm not sure if credit union could do that legally, but that I'll set up a discussion with Jennifer, right? That's, yeah. And Jennifer does incredible work in this community, especially in our downtown residential area. Jake?
I want to echo some of the other sentiments, but years back, and I think Bill alluded to this at one point, but years back there was a grant that was to make sure the students could, or grow the number of students that could read on grade level by third grade. And the initiative kind of landed all with the schools. And I'm just, I guess from a parent hat perspective, I've got a son who struggles to read or has been, but who's made a lot of gains recently. It's hard work, and it's taken everyone we can talk to focus on the reading, me reading to him, with him, my wife, family members, after school supports, the teacher that will work with him before school. But we've made it a focus in his world at his age level, because it's so critically important. And I know that as an educator, but if this lands with, well, the school is going to implement a particular thing, it will fail. And Mayor Kayer, you said that to start, that this is bigger than that. But I want to put an emphasis on this, that it's not just telling kids it's important to read. If, you know, when you mentioned Tree Street, they should have a reading intervention program. We can work together to train people in comparable systems so that the vocabulary for students is the same, but in after school programming, they should be doing reading intervention. People should be talking about it at home, and sharing those books, and we can push out things from a campaign perspective of reading every day. I mean, there's lots of ideas of ways to do this, and I know that we can be a conduit because we're the education institution connected to this, but it really truly is an everywhere you go thing. I think of even simple ideas of how excited some kids were to get a pizza coupon because they finished a book. I mean, there's businesses that can chime into this, you know, go get a free ice cream because you read a book over the summer. I mean, there's little things that we can do to preach the importance of reading and make it a community effort.
Book It was literally my most favorite thing in the entire world in elementary school.
Book It was the Pizza Hut one, right? Yeah.
Yeah, we're really fortunate too in our community because there are plenty of partners, and you know, even just looking on the screen, Marcella, I mean, what role could our library play in helping get children prepared for school and third grade reading? And we just don't think of that always, to really tie in the community. So it takes a village is what I've been told many times. All right, any other questions or comments from the committee? Okay, seeing none. So our next meeting, we're going to have Misty Parker from our Economic and Community Development Department give us a small presentation on the Choice Grant, so that, and then Shanna Cox from the Chamber, thank you, from the Chamber. She's working on a program, Strength in LA, which is focused, I think, on workforce development. Again, hopefully identifying people that are kind of stuck in poverty and don't have the skills to move up to living wage and jobs. I think that's but anyway, have those two come and present to the committee on the work they're doing and see if there are areas that we can collaborate in, or at least not step on toes, so that we're doing work and kind of focused on common goals. And then we'll start the work group introductions and just hear a little bit from them directly. That'll probably be at least a 2-meeting process, working through the working groups. And I'll try to keep every meeting to an hour and a half. And I think we did really well. We have 2 minutes to spare. And I want to thank everybody again, and I want to thank you all for challenging me as mayor, because that just makes me a better mayor. So I really appreciate that. Any other final comments, statements? Seeing none, I thank you all very much, and we'll get some dates out for our coming up meetings.
Thank you.
Thank
Good
you.
evening.
Thank you, everyone.